Hi all, welcome to this webinar with Steve Mermell, who is the city manager of the city of Pasadena. And as a former resident of Pasadena, I connected with him almost 2 years ago now, when I felt I needed someone authoritative to interview for my public administration theory class. And I wrote him an email on a whim, and he replied to my surprise. Since then we've been in touch. We of course did the interview. And he's been a very approachable and very, I would even say, generous with his time in terms of offering his inputs. Steve has been with the city of Pasadena for over 37 years.
Just 30.
I'm sorry?
31 years.
31 years, my bad. Over 31 years, and spent most of his career with the city of Pasadena, and also serves, among other things, as one of our advisory council members for the MPPA Advisory Council. So welcome, Steve. The floor is yours, and I will take care of the PowerPoint for you. And we will hear from Steve for about 30 to 40 minutes. And
or 20 to 30.
20 to 30 minutes. And then the rest of the time is for Q&A. Can you guys see my screen?
Yes.
Yes.
Okay, perfect. All right, sir.
All right, so why don't you jump to the next slide? So can everyone hear me all right?
Yes.
Yes.
Good, okay. So let's talk a little bit about the city of Pasadena. You may be familiar with it or not, but our population is about 150,000 people. And lots of times people think we're bigger than that because of the name recognition, because of the Rose Parade and the the Rose Bowl football game. But about 150, kind of a medium-sized city. We're 23 square miles. The city is very ethnically diverse. We're also very diverse economically. I've been told that only the city of Palo Alto has more diversity economically. So that means we have many, many really rich people. A lot of the rich people that buy homes in LA and don't want to be disturbed buy them in Pasadena. Paul McCartney is one, and a lot of actors and actresses, Oscar De La Hoya, the boxer. So there's a lot of really rich people. We also have a lot of people who are very low income. So it's very diverse. We have only one major hospital in the city. We used to have two, but maybe a dozen years ago, St. Luke's Hospital closed. And so there's just one. It's Huntington Memorial Hospital. And they have 40% of the market share in the San Gabriel Valley. There's about 1.5 million people in the San Gabriel Valley. And so as it relates to having to treat people with COVID, Huntington Hospital is going to have a lot of patients. They're currently, I think, number 6 in the state for the number of COVID patients that they have. And I'll talk a little bit more later about the cities partnering with them. We have a council manager form of government, but Pasadena is a complicated place. So what makes us a little different is we have 7 council members elected by district. And then about 20 years ago, they instituted a citywide elected mayor. So it's not a strong mayor. The city manager still runs the city day to day, and the mayor doesn't really have any more power than the other council members. They only have a vote like all the others. They just have slightly more power. They set the agenda, they run the meetings. But for all intents and purposes, it's like having 8 different bosses. We're a full service city. We have our own water and electric utility. Of course, we have the Rose Bowl Stadium. We have a convention center. And we're only one of 3 cities in the state that has its own public health department. Berkeley has a public health department, and the city of Long Beach and Pasadena. So that is interesting. A lot of the things I'm going to talk about are unique about us being a city with our own health department. So let me quickly kind of go through a timeline. And it was sort of the 15 days of crisis, if you will, because all these things happened in a really condensed period of time. Again, effectively like a 2-week period. So back on the 4th of March, we declared a local health emergency. Same day as the state of California and the county, because we all knew what was coming. So you declare the local health emergency, and on the 10th, we had our first locally confirmed case. So we knew it was coming, and it was in a way good because everyone was on eggshells. When are we going to have a case here? Are we going to avoid this or not? We got our first case on the 10th. And what started to happen at that same period is it seemed the first domino was colleges started to shut down all across the country. You saw that students were going home and they were shutting down. Knowing what was coming, on the 11th of March, the city hosted a COVID response planning workshop for 10 other cities in our San Gabriel region. The state is broken up into these different disaster planning areas. So this was our planning area. And we brought in police and fire and administrators from other cities to talk about the practical issues we're all going to face. At the time, one of the biggest concerns was what happens when your firefighters and your police officers start to show symptoms. You don't want to get all of the cops and firefighters sick. How are we going to test them? Where are we going to put them? So a lot of interest on the part of the first responders. We also started to cancel all of our city events. Most other cities were doing the same thing. And everyone was kind of moving in this direction. On the 16th, I declared a local emergency where as city manager, I can do that, but it has to be ratified by the city council within 7 days. And likewise, the city council has to ratify the health order. So the local emergency ordered the closure of bars, nightclubs, gyms, theaters, restaurants, except for takeout food. And I was in a restaurant on that day meeting with a bunch of restaurateurs because they were nervous about what was going to happen. And I told them that when I got back to the office, I'd have to issue the order shutting them down. And they were very concerned, of course, about what's going to happen. Is it going to destroy their business? Are their landlords going to make them still pay the rent? There's a tremendous amount of anxiety for business owners. On the 17th, the city council took action to certify my declaration of local emergency. They also enacted eviction moratorium for commercial and residential properties. As people were losing their jobs, of course, they're all afraid that they won't be able to pay the rent and they'll be evicted. So the city council prevented that. There were only about 55 cities in the entire state. There's just under 500 cities in the state. Only about 55 enacted moratoriums on eviction. Ultimately, Los Angeles County did it as well. We also did other things like suspending late fees and penalties. We said we won't turn off people's utilities if they don't pay the bill. And we eliminated most of our parking regulations. We're not going to write people a parking citation in the middle of a pandemic. On the 18th, the financial markets started to go crazy because it seemed like there was a liquidity crisis, meaning there's not enough cash. And the city, like most cities, have bond issues that we've issued in the past to pay for projects. We have 2 bond issues that were affected, one for the Rose Bowl, one for the conference center, our conference center, about $135 million, and then a smaller one for our parking garage, about $30 million. And we had been used to paying about 1% interest rate on these bonds. These bonds go to market every week and investors can buy them. If they don't want to buy them, there's what's called a put function. They put it back, they give it back. And the underwriter takes the bond back and tries to sell it to someone else. And in the normal world, someone else buys it and we pay them like 1% interest. That's what the market demands. Well, all of a sudden, our interest rate went from 1% to just under 6%. To give you a sense of magnitude, that's about $500,000 every month, that 5% change in interest rate. And then more distressing, some people didn't want to buy the bonds at all. And if no one wants to buy the bonds, then there's in effect an insurance policy that steps in and buys the bonds, and then it messes up your credit rating and you pay even more. Now, back in the Great Recession in 2009, we made some changes to allow us to buy our own bonds and hold them as city investments. And so we did that here to try to mitigate the impact. And what's interesting, after about 2 weeks, the financial markets sort of came back to normal. I think after the federal government started pushing out the stimulus, that issue went away. So that was good, but that was very frightening. Huge amounts of money. That same day, we started to close our city facilities to the public, our public counters, our libraries. We have 10 libraries in Pasadena, rec centers, community centers, city hall, lobby areas closed to the public. So we just closed everything down. And then we knew what was coming. We knew that the next day, on the 19th, was when LA County was going to issue its safer at home order. And because Pasadena and Long Beach, we're part of Los Angeles County, but because we have our own health department, we have to issue our own orders. If LA County Public Health issues an order, it doesn't apply to us and it doesn't apply to Long Beach. So we're scrambling around to make sure that our order is consistent with LA County, and Long Beach is doing the same thing. And then that same day, Governor Newsom issued his stay-at-home order. But his order, it's pretty generic, and it leaves room for counties to do things more strict, but you can't be less strict than the governor. And I'll talk a little bit more about his order in a few minutes. And of course, there's widespread closures, and only essential businesses are allowed to operate. Take a quick drink of water here. Okay, and then we had our first city council, well, we had a city council meeting on the 6th of April, and we had to work out how are we gonna have the council meeting, just like you're all doing now. It was done with Zoom and things, but we also have to allow the public to participate. So how are you going to allow public participation? And if public comment, people want to send in things, our city clerk would read them aloud. And so everyone's figured out how to host council meetings electronically. One of the things the council did at that meeting, because we were so concerned about the hospital being overrun with COVID patients, that's the big fear here, that the medical providers won't be able to care for everybody. We used our conference center because it's empty, no conferences, and the council approved establishing a 250-bed alternative care site, which is really just a fancy way of saying there's a whole bunch of curtains and drapes set up, and there's 250 10-by-10 little rooms with a cot, a little hazmat bucket, a Tupperware, and a light bulb. And if need be, the hospital could move patients to this facility. The thought would be, this would be patients who are sick enough they need to have medical care, but not so sick they need to be on a ventilator. So these would be low acuity patients. And then if things got really bad, sadly, it may also be a place where we could put people where all you could do is provide them essentially hospice type comfort because they're not going to survive. And I'll just tell you, this is morbid, but we have an ice rink over there as well. And there were discussions about, well, if we needed to, could we use the ice rink to store people who succumb to the disease? And the answer is no. The LA County coroner doesn't allow that. And so we didn't go there. But it's really amazing to have those conversations about, gee, could we use this? Another thing that we did, one thing that I'm actually really proud of is there's a lot of discussion about what can government do to help residents and businesses during this difficult time. The city, like most cities, is going to have some difficult budget challenges as a result of this. We estimate over the next 2 years, we're going to lose $30 million in revenue, and we're not sure how our future projections look. It all kind of depends when we can reopen and how many things move back to the way they were, or some things may never come back how they were. So we'll have to wait and see. So in an effort to help people, but protect our general fund, we have, because we own our own utility, we've been collecting money from our electric customers to pay to convert the overhead power lines to underground. And it's a very expensive thing to do. We have a lot of money in this fund. We can't quite spend it fast enough. So there was like 50 million bucks in this fund. And incidentally, about 10 years ago, someone embezzled $5 million from that fund, and we got all the money back. So it does have a dubious distinction. But I got the city council to agree to give back to all of our electric customers 2 years worth of collection, which totals a little over $1 million. And so most residential customers get about $200, but restaurants are getting thousands of dollars. And we have 100 businesses that are getting over $10,000. One of our local hotels got $40,000. So it's a way that the city can help our economic base still protect our general fund. So it was a win-win, and I'm really proud of that. We've already sent out $9.5 million. Okay. So then more currently, there's a lot of discussion about face coverings. And I know that in the city of Glendale, their city council said you got to wear a face covering whenever you're outside. I'm fortunate to have our health director who can tell me what is based in science and fact and what is just fear. So she issued an order on the 11th of April that said, if you're going into an essential business, like a grocery store, you need to have a face covering and you need to observe other precautions. The operators of the grocery store need to provide sanitation and hand washing for their employees, social distancing, plexiglass by the register, and other things that will help avoid the spread of the disease. In Riverside County, I understand they also ordered everyone to wear face coverings. My favorite is watching people drive cars by themselves with a face covering on. That obviously does no good. The purpose of the face covering isn't to protect you from someone else, it's to protect everyone else from you coughing if you have coronavirus. So people are very confused about all that. And then on the 12th, we issued a order related to our long-term care facilities. Every fatality that we've had, and we're up around, I think about 50, has been someone who either lives in or works in a long-term care facility, most of them being skilled nursing facilities. These are, of course, people who have underlying health conditions. They're generally stuck in a bed, and they're very susceptible. And unfortunately, most of the employees that work in these facilities, the facilities don't offer people full-time jobs, so they don't have to provide them benefits. So they work part-time. They work part-time in multiple facilities. So someone gets sick, an employee, they go to work, maybe they take aspirin or Tylenol to make their fever appear not to be bad, so they go to work, and they get the other employees and the patients sick. And then they go to their other job at the other care facility and do exactly the same thing. That's why you're seeing breakouts at these facilities. It's very troubling. So our order limits the entry. No people can go in and out unless they work there. You can't go visit your family members if they live there, which of course is very difficult on families. They're screening for symptoms. If you're sick, you're not coming to work, you're going home. No communal dining. Everyone is eating in their room or their bed, and everyone has to wear a surgical mask and face covering, and there's been other prevention efforts. We were early on with our order. 2 days after we issued ours, Long Beach issued a similar order. And then just today, LA County issued the same order. What's up on the screen right now is what we call our COVID-19 dashboard. In these days of data, so many of our members of our community are saying, I want the data, I want to see it. I don't know if that's really a healthy thing. I think some people are getting way too obsessed about the numbers and the data, but we put this together and we update this as often as we can, at least weekly. We're trying to do it daily. And you can see the different data here. We have how many confirmed cases in the city. And again, Pasadena, 23 square miles. Let's use the example of those skilled nursing facilities. If you live in Pasadena, you are our case. So a resident of the skilled nursing facility is our case and we will track you. But the employee may not live in Pasadena. So if they don't live in Pasadena and only work in Pasadena, say they live somewhere else in LA County, then they're LA County's case. So it gets confusing for people when they ask about, well, how many cases at this nursing facility? Well, we can confirm how many that live in the city, but the workers, someone else has to confirm. It's very troubling and confusing. But here's our breakdown. Men are more susceptible to dying from the disease, but you can see more women have actually tested positive. You see the breakdown in ages. There's been a lot of discussion about impacts, disparate impacts by race, with African Americans having high numbers. In Pasadena, it's actually pretty low. And one of the challenges is a lot of the people that get tested, no one is tracking their race or ethnicity. So when you hear that a particular group is getting hit harder or one group is getting hit not as hard, you got to look at that carefully because a lot of the data, there's holes in it. But this is just what we're putting out, and you can see the rise from the 23rd, let's say, of March, when we have a few cases, up to the 22nd of this month, where we're up at 263 cumulative. And then down below, we have the confirmed cases, and then the death rate. And because it's very spotty coming back from the lab, we sometimes get a lot of results at one time or no results. The labs are required to report to us after they do the testing. They're not all always good at it. So the little blue bar chart, you can't really draw many conclusions from what happened on April 13th. That maybe just some lab provided a lot of data that day. So why don't we keep moving forward? Okay, so that's the background. A lot of you know all that, but now's the part where I kind of pivot and talk about what it's like in the municipal setting and where things are going. So, you know, in any city or any county or what have you, you've got a lot of constituents and a lot of stakeholders. So I listed a few of them here. First and foremost, of course, is the city council. And it's paramount for someone in my position to keep pushing information to the city council people, emails, text, phone calls. It's just important to keep them up to date with what's going on. And of course, the challenge is things are happening very rapidly. You're very, very busy. You're responding to everybody. You're having 1,000 different issues. And so you're trying to work through that. And I see there's a question. Was anything done to increase the stock of critical medical equipment to treat? So the city is not responsible to get respirators and things. That's for the hospital. And yes, they did that. What hospitals were ordered to do was to try to increase their capacity within their own walls by 40%. And so Huntington Hospital believed that they could do that. And hospitals are licensed for a certain number of people. Huntington Hospital, about 650, but on a normal day, it's in the low 400s. And they were able to get back to the 600 pretty easy. And they ordered more ventilators. They have 70 ventilators, and they ordered some more. For the city, we started scrambling around for PPE, and I'll get to that in a few minutes.
Steve,
but kind of back to our constituents.
Let's take.
I'm sorry. Go ahead.
No, I said let's take questions at the end. Once you're done.
Okay, great. So one thing about city councils is they're used to making decisions, and throughout this process, a lot of the decisions are being made by the health director and by the city manager. When I'm wearing my hat as the director of emergency services. And that's, you know, in the first few weeks, it was okay. Myself and our health director were able to make a lot of the decisions and direct the staff. But now in the last week or so, I can see that my city council is getting a little antsy. They want to make decisions. I'm hearing that's the case in other cities as well. And so part of the challenge is deciding what are the things the council should decide from a policy level? What are the things that should be left with the city manager and the health director? And I'll be honest, it creates a little tension because not everyone is always in agreement. With city employees, we have about 2,200 city employees. And we have, of course, our police and fire. You know, they're on the front lines. They're worried about responding to a call and getting sick. So it's vitally important to make sure that they feel supported and encouraged, that we give them what they need to be safe. We've had to quarantine some employees. We've used the Rose Bowl. The Rose Bowl has some nice suites. And so early on, we had to quarantine 5 firefighters and 6 police officers who thought they were exposed, and we don't want them to get their coworkers sick. I've been pushing emails out to city employees at least once a week. I've been holding weekly calls with some of our dozen labor unions. You got to just communicate. You can't over communicate. And it really runs the gamut. I know police officers that will think nothing of running towards trouble, or firefighters that will run directly into the burning building. But some of these same people are deathly scared of getting sick. And this type of invisible threat, everyone responds differently. And so you have to realize that you're going to have the worried well. You're going to have employees who say, gee, I don't want to be at work. I'm afraid. I want to be at home. And then a lot of employees say, well, if someone in the building gets sick, are you going to tell me? And early on, of course, there's concerns about HIPAA, you know, privacy rights. And so we'll talk about that in a minute. Pasadena has very active citizens, and I try to respond to every email I get from citizens, like, you know, Sabith, you know. And so everyone's got an opinion. Most people seem to be in favor of making sure things are closed off and we have the stay at home. But there's other people who say, no, I want to get a haircut, and you should open up the Rose Bowl recreation loop, and they don't like what they're seeing. I also get a lot of email from people who are sort of thinking off their employers. They say, I work in town and my boss is making us come to work and we're not socially distanced, or there's a business in town that's still operating. You know, I've spent more time on whether dog grooming is allowed than probably any other issue. And everyone, again, has an opinion. Local businesses are looking for support. We're trying to do our best. We created a website where local restaurants can register, and we send that out to our citizens for them to order takeout food. And we're providing resources so they know how to apply for stimulus money and SBA loans. And so we're trying to be that resource for them. The city got a $2 million grant to support the hospitality industry. Most of the hotels have occupancy of about 10%, so they've laid off hundreds and hundreds of employees. And then for a lot of businesses, you know, everyone wants to be considered essential because they want to be able to operate. What is essential is a function of a guideline put out by the federal government. The federal government put out a critical infrastructure guide, and then the state's order references the federal guide. And if it's in the federal guide, then it's essential. If it's not, it's not. But lots of times things require interpretation. And then just other stakeholders, we are in frequent contact with other area cities. I was speaking to the city managers of Glendale and Burbank yesterday, and we're frequent contact with LA County. So some of the key challenges that we've had throughout this process. We don't have what's called unified command. In the state of California, we have an emergency operations protocol. And when there's a disaster, like an earthquake, a big fire, and jurisdictions need to get together and work together to deal with it, they usually implement what's called unified command. So if the City of Ventura Fire Department and the City of Simi Valley Fire Department go to the same fire, they're going to work under a unified command, and whoever was on scene first is the commander, regardless of who that was. In this instance, our health department was not brought into LA County, nor was Long Beach in a unified command model. In retrospect, I would have preferred that. I would have liked to have assigned staff down to the county headquarters so we were in more frequent contact and all of our orders would have been consistent and we wouldn't be spending time having to read what the county's putting out and then tailor it for our needs. Another big issue, and this is no surprise to anybody following the news, is there's no particular agency responsible for testing. Everyone thinks because the city has its own health department, we should be doing the testing. We don't have a lab. We don't do testing. The way that a public health department works is it's mostly surveillance, and they get data back from labs. So no one's responsible for the testing. Everyone's running around. Everyone's trying to figure out who's doing the testing. And that was obviously one of the issues, and it's an issue nationwide, of course. The lack of definition in state orders, the governor has gotten pretty high marks. He's done pretty good, but a lot of the things he's put out are fairly vague, and they leave it to the local jurisdiction, which in most cases is the county, to decide. So you get this differentiation across counties, and that feeds into the city of LA, the county of LA, and other counties doing their own thing. There's really no reason why Mayor Garcetti needed to issue his orders, because city of LA is in the county of LA, and the county's orders apply to the city. But he's a politician, and politicians like to do stuff, and they like to be on TV. So LA issues stuff, but it's not always consistent. For example, early on, the city of LA said no to golf. I mean, city of LA said yes to golf. I'm a golfer. City of LA said yes to golf. And the county of LA said no to golf. And then about 3 days later, the city came around and said, okay, no to golf as well. On that point, you can't golf in LA County today, but you can golf in Ventura County and San Luis Obispo County and Orange County. And so it's kind of weird that you have this patchwork of regulations, and there's just so many orders that it does get confusing. It would be so much easier if the state had promulgated statewide orders. The governor felt that the state is varied, and he's right, and so he didn't want to get that detailed. Another big challenge for us is Pasadena is, full service city, and also maybe a little paternalistic. We really do take care of people. So there's a lot of demands for the city to take the lead in all sorts of things, like the wide scale testing. Also, when it comes to food insecurity, very early on, there was pressure for the city to step in. The city council gave me $150,000 to provide meals to school district families and to other people who are facing food insecurity. And then on Monday, they gave me another $200,000 to work with our local food banks and food pantries to provide meals for people. So that's a great thing that we're doing, and our city council really took the lead. But again, everyone looks to City Hall for support. And again, ensuring that the hospital can manage. The hospital is a separate entity from the city. We don't control the hospital. We don't underwrite the hospital financially. But again, making sure that if the hospital is overrun, there was pressure on us to make sure that we help them. And that's why we set up that alternate care facility. And then, of course, there's this pressure in providing financial support to residents and businesses. Now, we're not getting any federal stimulus money. The federal stimulus money only goes to cities of $500,000 or more. And the state of California hasn't indicated that they're going to give any money to local cities, yet we're asked to give money to people. I saw today that one area city in San Gabriel is giving about $10,000 business loans or grants to about 60 businesses. And that's why our rebate of the underground surtax charge was so important, because that's over $11 million. And that's how I'm trying to address that. And for the residents, how we're trying to help them is with the eviction protection. And we do have some community block grant money that we can use for rent support. And then the key challenges internally is, of course, managing our workforce and making sure employees' morale is good. I mean, these people are working very hard. Today was the first day since like March 9th that I actually let myself kind of have a half day off. So we have people working very long hours, and getting the personal protective equipment early on was a challenge. We had our librarians sewing masks for people, and we did everything we could. We did have a stock of the N95 masks, which we were able to give to our police and firefighters. And so that was helpful, and we scrambled. Now we're in pretty good shape. But you know, when an employee says, hey, I don't feel comfortable going out and doing my job, or I don't want to ride in a truck with another employee because I don't feel safe, that's a real concern. So you want to make sure they have the tools they need to be safe. We quickly adapted protocols to limit exposure. In a lot of areas, we moved to A and B shifts so employees didn't come in contact with each other, or we could limit that. Again, we have a power plant, and it takes a number of people to run the plant. So we have to have at least 3 people there all the time. So we went on different shifts, so people on different shifts would never see the others and never come in contact. And then early on, when someone got sick, what do? Who do you tell? You go in, you clean their workspace, and then you go talk to anyone they had contact with. And you tell them to go self-quarantine for 14 days. But what happens to employees that say, go use the gas pump? Maybe they're sick, they touch the pump, they leave, and then another employee comes up and touches the pump. They don't know who was just there. So what precautions can we put in place there? Gloves, disposable gloves, hand sanitizer, you try to mitigate that. And then just general fear. You know, a lot of, again, as I mentioned, people are different. Some employees are very afraid of getting sick, and a lot of employees are very afraid of losing their jobs. I was able to tell the employees first, no one has anything different. Their pay is all the same till April 19. And then with the city council's approval, we pushed that out to June 1. And now I effectively have everyone still in next year's budget, which starts July 1. So I'm trying really hard to make sure we don't lose jobs. A lot of cities have said they're going to let people go. San Diego let 400 people, well, more than that. They let 700 people go. Santa Barbara let 400 people go. Santa Monica is going to let a lot of people go. And these are cities that rely heavily on visitors, hotel visitors and the like. So they're taking it on the chin financially. Pasadena has a strong economic base, relying mostly on property tax. So we're in better shape. And then just how do you sustain operations over the longer term? In terms of decision-making, every single day for an hour to 90 minutes, I meet with all the department directors. Some of them are in our room, some of them are Zooming in from home. And we just talk about what are the issues, and we break the work down into who's gonna do what. We follow the protocols that have been established through the Emergency Operations Center. So our procurement people are responsible for logistics. So if someone needs PPE, they make a request to logistics. If someone needs to get a hotel room to put a homeless person in, they work through logistics. They're responsible for pulling together all the resources that we need. Then we have a financial tracking unit, because ultimately whatever we spent about $2 million, that we're gonna ask for reimbursement from FEMA. So we have all this compartmentalized org chart, and that's how it works. For me as the city manager, one of the big issues is how deep do I get involved in any particular issue, or do I just assign someone to run with it? You got to recognize that there's a whole lot of things beyond your control that you can't control. And then from time to time, you have too many chefs in the kitchen. And that kind of gets back to when some of the council people want to get involved, when members of the public want to tell you what to do. And even internally, sometimes, you know, with our executive leadership staff, you can just have too many people and you just need to make a decision and move on. So some of the other challenges, this is my final slide, the financial impacts. Nationally, they're predicting a gross domestic product reduction of 3.3% for this current year, but they're anticipating growth of 3.4% next year, and then a little slower for the year after that. We're all hoping, of course, that's true, and it all depends when we get back to it. For Pasadena, we've lost a lot of sales tax. We've lost a lot of transient occupancy tax. That's the hotel tax. It's $30 million over the next 2 years. The good news is we're in strong financial position, and frankly, we can absorb that in the near term. Over the long term, if things don't come back, we will have to reduce services to balance our budget, and we would have to contemplate layoffs, although I'm hoping not to have to do that. And then the big issue as of late is how to reopen and when to reopen. We've done some research, and I think it's a good thing. Local counties really can't go it alone. They have to stay consistent with the governor, whatever the governor sets forth. So as long as the governor is saying that we have to do the safer at home, that's going to be the rule. And we don't have the latitude to tell restaurants to open, for dine-in seating, or for retailers to open. Obviously, for Pasadena, we do the annual Rose Parade. Will there be a parade this year? January 1 is a long way away now, but there's an awful lot of work that goes into that, and it starts now. They start building the floats now. The college football teams would be coming back to school in August to train, and you'd have a college football season. There may not be a college football season. If there's no football season, there may not be a parade, because the parade is paid for really by the revenues from the football game. And as I mentioned, we have the stadium, we have our golf course, we have a convention center. If we don't have events, we have no revenue. The Rose Bowl has a debt payment due of $4 million in August. The city may have to cover that debt. Now, maybe we make one payment, there's another payment in February. So we may have to make another payment in February. So how long does this go on? We do think we can open the golf course the middle of May, and that will help. The golf is less popular than it used to be, and it doesn't make as much money. And then this big issue really is how long before large gatherings are allowed. Once we move to phase 2, which happens after there's 14 days where the number of cases are going down, gatherings are still supposed to be limited to 10 people. And then after the signs that things are still going in the right direction, you can move to the next phase, and gatherings, this is based on the federal government guidance, are 50 people, where the Rose Bowl holds 90,000 people. So how long before we can have a concert or a soccer match? That's a big, big challenge for us. Those are my slides.
Wonderful, Steve. This is great. Thank you. Thank you so much. With that, I think we can open up for questions, and I'll stop share screen here. All right, guys, it's your chance now to ask questions. I already see some questions here. Was anything done to increase the stock of medical equipment necessary to treat the most volatile cases, respirators, for example? Why or why not?
Right, and the hospital did that. They had 70 and they got another 100.
Okay. Okay. Any other questions, guys? This is your time to ask questions. Either you can type or you can ask on your mics. You can unmute yourself.
Dr. Khan, I have a question. First, I'd like to thank Steve for taking the time to come and speak to us. This is a rare treat for us to get like a firsthand experience from a city manager's perspective. Steve, going along with sort of what we've talked a lot about in the past couple of weeks, I have a quick question for you. So I've seen that the city has around 8.4% of its workforce population in the hospitality industry. What is the city thinking about as far as any projections as any businesses that like might fall off because of the impacts of the COVID? And what is, are there any city projections as far as like what they're expecting as far as any fall offs as far as businesses not being able to come back?
Sure. In addition to the hotels, I suspect our biggest concern is restaurants. On a per capita basis, supposedly Pasadena has more restaurants than New York, on a per capita. So it's a big part of our local revenue base. And there's tremendous concern that the restaurants aren't going to be able to weather the storm, and a lot of them are going to have to close. And so that would really hurt the city. We have a lot of unique restaurants, and that is a big part of who we are. So if that goes away, that's going to change things in a pretty profound way.
Okay, any other questions, guys? If not, I have a few questions for Steve. Anyone else? I think you guys had an earlier question, maybe a follow-up to that. Okay, let me get started, Steve. In terms of, sorry, go ahead.
Dr. Khan, I do have a follow-up.
Go ahead, Greg.
From a city manager's perspective, Steve, you hear a lot about what's coming down from the governor. You hear a lot about Mayor Garcetti, but from a city manager's perspective, when we do come to whatever that date comes that the restrictions can start to be laxed, what is the mindset of the city manager of, okay, we have laxed issues, what's my first step as to start rolling things out, but also being wary that we don't want a spike to come back up. So what is Pasadena's mindset and your mindset as far as starting to ease up the restrictions, but making sure that you're being wary of not having to fall back into a stay safer at home restrictions, if that makes sense?
Right. So first of all, I'm confident that we won't move ahead the rest of LA County and hopefully the region. We really can't by the order of the governor. So what that means is the city couldn't say that bars and stores can open, but what the city can do is open recreational areas, because those fall into a different category. So we could open the loop around the Rose Bowl. If people are familiar with that, a lot of people like to run and jog around that. And that concerns me because, in effect, that's a mass gathering. So I'm concerned that my city council may want to open that to look good, and it creates problems. I'm worried that they'll want to open pickleball and tennis courts and hiking trails. So that's one set of concerns. But I know what will happen once there is some easing up. Let's assume it happens through LA County and maybe as well as Ventura, Orange County. I will be spending all of my time, and a lot of my staff will be spending time explaining to people what is now allowed and trying to discern whether someone is complying or not complying. Can someone sell cars now in person, or does it have to be appointment, show homes in person? And so it'll be the tedium of all of that. And then everyone's going to be watching it to see, okay, once we lighten up, you kind of have to wait 14 days and see if the number of cases have gone up dramatically. If the number of cases go up dramatically after you loosen up, then you're going to have to go retrograde. And that's going to be even harder, I think, than staying sort of frozen, because people are going to say, no way am I going back to that. So I really hope that we don't lighten up too early, because I'm fearful we'll have to go back to sort of phase one. And that's going to be so hard.
Sure, absolutely. I think it seems like thanks for that, Steve. Looks like a delicate balance between taking the right decision for opening up or staying in place, right? So what suggestions or advice do you have for not just the residents of Pasadena, but anyone in any city? To what extent do you think they should be pressuring their cities or listening to their cities? Because again, it's a delicate balance, right? Some of them, as we were talking earlier, have legitimate needs of going back to work or just making a living. So what role do you think the federal government and also even local governments have in terms of facilitating people's work or helping them financially? Any thoughts on that, Steve?
Well, you covered a lot of ground. I think that it's good for people to engage with their city and with their elected officials. Hopefully that would be people suggesting that whatever decisions are made are based on fact and medical science. Mm-hmm. I acknowledge that there's other opinions out there. And there's some people who feel that, no, the economy is so important that we need to open up, otherwise people will starve. But it's interesting, something like 140 nations across the globe have had this virus or have it currently. And by and large, they're all kind of doing the same thing, which tells me that's the right thing. The distancing, the shelter in place, the restrictions, some places are more harsh and some places are more liberal, but generally that's the way you deal with this. So that seems to be where we need to stay and not let up. If the data that I see, and the hospital's been good sharing data with me, if we let up today, everything that we've done up to this point in a couple of weeks will be for naught. And 95% of people will get it. And of that, 5 to 15% will need hospitalization, and that will overwhelm the hospitals.
Scary prospects indeed. Any final thoughts on advice for young potential city managers or people working in the public sector in terms of what kind of lessons can they learn from this experience? I mean, is there a silver lining at all, if there's one?
Well, I hope that as a country that this experience sort of reintroduces people to facts and science. And there's obviously a push and pull in our country, but with facts and science, and you can see it sort of daily in the briefings where Dr. Fauci speaks and then maybe the president speaks. So I hope that there's a return to facts and science. And for public administrators, you know, this is the most difficult professional thing I think I've ever gone through, or certainly one of the top 3. The city manager of Santa Monica is gone. He lost his job, he resigned. They let go of the city manager in Anaheim. I understand other city managers are retiring because it's a really difficult time. It's really political and nerves are on end. If you can get past that, it is testament to how well local government is working to meet the needs of the citizenry. We haven't missed a beat in Pasadena. We still pick up the trash. We're still doing everything. I think most cities are operating correctly. And what we need most of all in local government is smart people to go into it. And so all of your students who are interested in it, you know, compliments to you, because it really is service. Our public health people are working 24/7 to make sure that the folks in the skilled nursing facilities live. And, you know, that's a very important function.
Absolutely, absolutely. We still have time for just 1 or 2 more questions. There's one comment on the chat box from Leo. What are the IRS implications with the bond buyback, lose tax deferred status? I mean, what does that implication have on the tax status?
Well, so they're tax exempt municipal bonds, so no tax impact. But obviously, had that problem continued, we were bleeding $500,000 a month, totally unsustainable. So I know that municipalities have asked the federal government for relief on bonds, but the federal government is being very stingy towards local government right now. In fact, you know, Mitch McConnell the other day said, "Let them go bankrupt."
That's a bad idea.
All right. Any final questions or any final thoughts from anyone?
Yeah, I do have a question. I don't know how to necessarily word it, but I'm going to try my best. Thank you, Mayor Mermell, for speaking and educating us on some of the things you can do.
Promotion, Mayor.
Steve, the city manager.
City manager. Well, there we
Promoted me.
better. No. I guess, yeah, I don't know how to pose this question, but I'm curious to know from your perspective if one thing can change or if something could be better to help you do your job or, you know, the work you do, what would that be?
For it to be July.
Right. I think we're all in that same boat there.
Yeah. I don't know. I suppose at a practical level, I'd like to see us part of unified command with LA County Public Health, and I'd like to see the governor's orders apply uniformly statewide.
Okay. Well, I'll pray for that then. Thank you.
We could, as a collective, maybe send some emails if that helps.
I think we're too far gone now.
All right. Well, we can do the little that we're able to. But this has been great, Steve. Any final thoughts from you or from anyone else on the call before we wrap up? Steve, you want final words?
Well, I really appreciate the opportunity to talk to you all, and kind of share a little bit about what's going on. It's nice, it's cathartic, so thank you.
Absolutely, and it's been great to engage with you as you're going through this process. And if there's anything we can do as a school or as a program, we'd be delighted to help.
Yeah, well, and Greg's helping me out with how we might be able to help our local restaurateurs. So I really appreciate that.
Likewise, we appreciate the opportunity to engage with you. So Thank you so much. Have a good weekend. Everyone else on the call, yeah. Take care, Steve.
All right, bye-bye, everybody.
All right, thank you.
Bye.
Thank you.